The topic of my presentation today is anatomy of jugular foramen. So starting with the introduction, the jugular foramen is the cranial foramen located posterior to the carotid canal, and it is formed by the petrous part of temporal bone and the squamous part of occipital bone. It is where the sigmoid sinus in inferior petrosal sinus drain into the internal jugular vein. Also, the cranial nerve 9 till 11 traverses through this foramen, along with ascending occipital and pharyngeal arteries. With these nerves traverses through this foramen. Now, this is basically the schematic view to show the relationships. Anteriorly, we have the internal carotid artery, which enters the skull through the carotid canal. This is the jugular foramen, which is formed by the petrous part of temporal bone and the squamous part of occipital bone. This is the sigmoid sinus, which is draining into the internal jugular vein, and this is the neural complex which traverses through the jugular foramen, which is basically 9, 10, and 11 cranial nerves. Now, the jugular foramen is divided into two-part classification. This is a relatively older, which was that the jugular foramen is commonly described in two parts, separated by a fibrous septum or a bony septum called the jugular spine. It is basically the intrajugular process on the opposing surfaces of the two bones, temporal and the occipital bones, and it divides the jugular foramen into two pars nervosa and vascularis. Nervosa is anteromedial and smaller part, and the pars vascularis is posterolateral and larger part. And so pars nervosa is the anteromedial portion of the jugular foramen. As we can see here, this is the bony septum, which is dividing the anterior jugular foramen into anterior and the posterior parts. Anterior is the anteromedial, and posterior is posterolateral and larger than the anterior part. And pars nervosa contains the inferior petrosal sinus, glossopharyngeal nerve. Here we can see the inferior petrosal sinus and the glossopharyngeal nerve as well. And the inferior petrosal sinus drains the cavernous sinus and courses in the petri-occipital fissure adjacent to the clivus prior to its exit through the pars nervosa and subsequent drainage into the internal jugular vein beneath the foramen. Now, the glossopharyngeal nerve gives a tympanic branch, which is known as Jacobson nerve, which reaches and supplies the middle ear along with the inferior tympanic artery. Now, pars vascularis is posterolateral and a larger portion of the jugular foramen, and it contains a jugular bulb, which is venous expansion sitting into the jugular fossa between the endocranial sigmoid sinus and the exocranial jugular vein. This is basically the internal jugular vein, and it also contains the vagus and spinal accessory nerves. Here we can appreciate the vagus and spinal accessory nerves as well. And the vagus nerve gives off an auricular branch, which is Arnold's nerve, via the mastoid canalculus on the lateral wall of the foramen, adjacent to the mastoid segment of the facial nerve. Now, the new classification is three-part classification, which has divided this foramen into three parts, two venous and one neural. So this one is the vascular or the venous compartment, which is also known as petrosal part. It is anteromedial and it contains inferior petrosal sinus. Then we have intrajugular or the middle or the neural compartment, which contains the neural complex that is glossopharyngeal, vagus, and accessory nerve. Here we can appreciate clearly glossopharyngeal, vagus, and accessory nerve. This is meningeal branch of ascending pharyngeal artery, which is traversing here. And then we have sigmoid part, which is posterolateral, and it contains the sigmoid sinus, which is draining into the internal jugular vein. Now, coming towards the osseous anatomy, um, here we can see this is the squamous part of occipital bone. This is the clivus. Here we have foramen magnum, and this is the middle cranial fossa, where we can clearly appreciate the foramen ovale, lacerum, and rotundum. And here we have the jugular foramen. So jugular foramen is formed by the petrous part of temporal bone and the squamous part of occipital bone. So temporal part is basically overlying the foramen, so we can't clearly appreciate here, but here we can clearly see that this is the jugular foramen. This is the petrosal part, anterior and medial, and smaller than the posterior lateral um, part where we have sigmoid sinus. This is the petroclival fissure, and 5 millimeters below this foramen, we have the hypoglossal canal where hypoglossal nerve exits. And this is the internal acoustic meatus where our seventh and eighth vestibule, eighth nerve complex enters. And this is the vestibular area where vestibular aqueduct lies here, and the lymphatic sac is present, which opens into the vestibular aqueduct. And here we have the interjugular process of the jugular foramen. So this is petrosal part, and this is the sigmoid part where sigmoid sinus enters the drains into the internal jugular vein. And in between, we have the neural complex, which traverses the foramen. And this is the interjugular process. So this process sometimes divides this foramen into two, and which divides into two different foramina. Here, so this was the superior view of the occipital bone. So we are viewing from above, and here we have the inferior view. Here we can see the occipital condyles, jugular foramen here, and this is the carotid canal where internal carotid artery enters the skull. And this carotid and jugular carotid canal and jugular foramen are separated by a ridge, thin ridge which separates both of them. This is the stylomastoid foramen where seventh cranial nerve exits. And here again we can see the laceramento veil. Here again we have the sigmoid part, which is the posterior lateral and the larger part than the anterior medial petrous part. Then we have we can appreciate clivus here, and these are the condyles. This is again the inferior view. So lateral boundary of jugular foramen is a styloid process, which limits the lateral axis of this foramen. Then here we can see anteriorly carotid canal. This is the carotid ridge, which is a thin ridge separating the jugular foramen from the carotid canal. Now, in this view, this is again, we are looking inferiorly from the inferior aspect. And here we can see that this foramen is separated apart to make it more clear. Here we have occipitomastoid suture. So we have intrajugular process of temporal bone and interjugular process of the petrous bone. They both are sometimes unite and divide this foramen into two. And this interjugular process is smaller in the occipital bone, and it's relatively larger in the temporal bone. This is the hamate process, and this is the petroclival fissure. Here we can see the sigmoid part posteriorly and the petrous part anteriorly. So the significance of this spine is that this interjugular ridge, this is the area where our 9, 10, and cranial nerve are traversing. So along the medial border, we have the 9 cranial nerve, which is glossopharyngeal, and the vagus and accessory are traversing slightly lateral to this ridge. Then this is again the sigmoid part. This is the petrous part. Here we can see the internal acoustic meatus where the seventh and eighth complex goes in, and cochlear duct. And here the area is the vestibular aqueduct where endolymphatic sac drains into it. Now this is the lateral view of the skull, lateral and inferior view. Here we can see the mandibular condyle. This is the styloid process, which is the lateral boundary of the jugular foramen. This is the jugular foramen. Now this is the transverse process of C1. So here the vertebral artery travels in the transverse foramina of the C1. So this is makes the posterior boundary or the limit of jugular foramen. Then we have external auditory canal, tympanic bone, and in this view, we can see the carotid canal, which is separated from the jugular foramen by this thin ridge, which is called the carotid ridge. Then we have, so we discussed two nerves which were giving off by the ninth and the 10th cranial nerve. So ninth cranial nerve gives the tympanic branch, which enters here, and the 10 cranial nerves was giving the Arnold branch, which enters here. So these are the groups for both of the branches of ninth and 10th cranial nerves. So this nerve basically enters the mastoid canaliculus and supplies there. This is again the occipital bone, and this here we can appreciate the occipital condyle. Now this is the similar picture of the osseous anatomy, which is now showing the neurovascular structures. Now this is the medial aspect, this is lateral aspect, superior and the inferior view. Here we can see the neural complex. This is the sigmoid part of the temporal of the jugular foramen. Here I have already discussed, we have the endolymphatic sac, which opens into the vestibular aqueduct slightly lateral. So here we can see that this is the cranial nerve 9, which is slightly medial. And then we have the 10th and 11th cranial nerves, which are traversing the jugular foramen, slightly lateral. And this was the internal acoustic meatus, which I've discussed, where 7th and 8th cranial nerves enters. This is again the similar picture. In this picture, we can again appreciate the cranial nerve 9, which is traversing here. Then we have cranial nerve 10 and 11 going into the jugular foramen. This is the auricular branch of the cranial nerve 10, which enters the groove present here in the mastoid canaliculus. And this is the sigmoid part of the jugular foramen. Here we have retracted these nerves, and we are basically showing the interjugular process, which is the process on the temporal and occipital bones, and medial to it travels the cranial nerve 9, which is we can appreciate here. And this is the cranial nerve 10 and 11, which are slightly lateral, and we have retracted them further. This is the inferior petrosal sinus, which drains into the internal jugular vein. Now, this picture is basically showing the relationship of vertebral artery. So we have atlanto-occipital joint here, and this is the vertebral artery which enters the transverse foramina and goes posteriorly and enters the skull. These are the cranial nerves 9, 10, and 11, which are making up the single neural structure and traversing downwards. Now here we will be seeing lateral view of the skull, and we will be removing these muscles. So here we have the external auditory canal, anteriorly parotid duct and gland, and these are the sternocleidomastoid muscle posteriorly. Removing that will show this is the tympanic part of temporal bone. This is the TMJ, which is the temporomandibular joint. And this is the superficial temporal artery, which is traversing upwards posteriorly here, which is the branch of external carotid artery. This is the digastral posterior belly. And these are the masseter muscle. Here we can see the cranial nerve 7, which we previously saw that was exiting from the stylomastoid foramen, which was slightly lateral to the jugular foramen. And here we have the internal jugular vein, which is traversing in the jugular foramen. So now here we can see its relation to the internal carotid artery. So we saw that the carotid canal is anterior to the jugular foramen. So here we have the internal carotid artery, and here we have the internal jugular vein. These are the styloglossus and stylohyoid muscles, which are supplying the tongue. And this is the tympanic bone. Here we have the levator velli palatini and tensor velli palatini muscles anteriorly. This is the ascending pharyngeal artery, which is also a branch of external carotid artery. And other than that, the here in this picture, we can again appreciate internal carotid artery anteriorly, internal jugular vein posteriorly. These are the cranial nerves which are traversing through the jugular foramen. So here we have 9 and 10 cranial nerves. And then we have the occipital artery here. And this is the external carotid artery, which is traveling anteriorly. So these 9, 10, and along with 12 cranial nerve, they travel in the carotid sheath anteriorly, along with carotid artery. This is again the similar picture. We are viewing it from the lateral aspect. This is the tympanic part of temporal bone. And here we have the inferior orbitalis muscle. And this is again the internal carotid artery, internal jugular vein. So we are slightly posterior, lateral and posterior comparative to this slide. This is again the similar picture. Here we can see the internal carotid artery, internal jugular vein, and here we have the incus and malleus, the tensor tympani muscle, and this is the promontory, and this is the part of the internal ear. And sorry, external ear. This diagram, this picture basically showing the neural structures. Here we have the internal acoustic meatus where we have seventh and eighth complex going. This is the jugular foramen. So this is the 9, 10, and 11 cranial nerves. Ninth is slightly medial, and 10th and 11 are slightly lateral. Here we have the endolymphatic sac, which opens into the vestibular aqueduct. This is the similar picture. Here we can see the interjugular septum. And so inferior petrosal sinus here, which is covered. This is occipital bone. And these are the neural structures which are traversing from the jugular foramen. This is the, so here we can see the auricular branch of the 10th cranial nerve. And other than that, this is again the closer view of this. So here, basically, we are showing the superior ganglion of the cranial nerves. This is the jugular tubercle. And this is the atlanto-occipital joint where vertebral artery is traversing, which makes up the posterior limit. So radiological anatomy, we can see this is the CT scan axial view. This is the carotid canal, and this is the jugular spine, which is separating the jugular foramen into two, which is pars nervosa and pars vascularis. This was the older classification. And this carotid canal is separated by the jugular foramen with by the carotid ridge. And this is the oxymetomastoid part where the this is the sigmoid sulcus where the sigmoid sinus runs and drains into the internal jugular vein. So this is again the similar picture. Here we have we have shown the two parts of the jugular foramen. This is the pars. This is the carotid canal.
तबीयत तो खराब होनी है बोला था समझाया कैंसर भी होता है सोचो जी.
So this is the jugular foramen, which is divided into two, anterior-medial and the posterior-lateral parts. Anterior-medially, we have inferior petrosal sinus and the cranial nerve 9, which is traversing. And then posteriorly, we have the 11th and 10th cranial nerves and the sigmoid sinus present. And this is divided into two by this jugular spine, which we can appreciate here. This is the coronal view again.
पिक्चर वैसे नहीं है इसमें इनको इंडिविजुअल दिखाया हुआ है जैसे हमारी मेजॉरिटी पिक्चर हम देखते हैं कार्टून ही हो बेशक जैसे लेकिन you need something to remember otherwise you won't remember.
इसमें दिखाया था मैंने।
कौन डिस्क्राइब कर तो पढ़ा चुके हैं ना ये कौन डिस्क्राइब करेंगे ये हमारा आपने हाँ इसका लिया ना फिर पैसे निकाल टेस्ट कर 2000 वॉलेट निकाल नहीं ये जो देर से आ रहा है उसको पेमेंट करनी होगी जल्दी करो मैडम आप ये 2000 रुपये अमानत अपने पास रखें हम खर्च करेंगे मजे से दो और कोई और भी था जो लेट था तो सच बोलो तू बता तो मुझे चल जाएगा चल चल जाएंगे और कौन लेट था तो लेट कौन था ये पूछ रहा हूँ मैं
सर मैं जो जल्दी आया था वो बता देती हूँ। एमन एंड डॉक्टर बच्चों ओवर हियर व्हेन आई स्टार्टेड।
कौन देर से आया ना ये बंदा एक से निकले जल्दी दो दे दिए चलिए ये झूठ तो बता मेरे झूठ बोलता है दो चेक करो ज्यादा रख 2000 निकालो इसमें से बाकी वापस करो उसको चलो कौन बताएगा हाँ जी she described नहीं खाली ये बताओ what are we seeing here she described yeah we came here this morning first we went to shower
there are two that system for healing of the foramen jugular foramen. Each can be divided into two compartments. But for in the anteromedial compartment was pars nervosa, pars nervosa, and posterior later was pars posterior. Now the reclassification divided into three compartments. Most medial one is the pituitary part, middle one is the intrajugular part, and later one is the sigmoid part. So they divided now to venous compartment and middle one is the nervous compartment. So in medial compartment there lies the pituitary sinus, and in middle compartment later the intrajugular compartment lies the nerve in the order starting from medial to lateral is the growth of pharyngeus, then vagus, and then epiphyseal nerve. After that, in the most lateral compartment is the large venous sinus, that is sigmoid sinus, along with laryngeal branches of the artery and fused veins.
सुनाइए इंफीरियर पेट्रोल साइनस कहाँ पर है कहाँ पर है इंफीरियर नोज पार्ट वैसे ये कितना यूज होता है न्यूरोसर्जरी
सर ये क्लास में इसलिए किया था वो जो जुगुलर फोरामेन सिंड्रोम है उसकी वजह से ये क्लासिफाई था
आईआईटी लेकिन कितना यूज होता है
मैंने प्रॉब्लम
रीड इट एवरी आंसर रिमेंबर गुड और कभी तो पेशेंट आता है क्या कहता है राइट याद रहता है ना मैं इंटरेस्ट आगे बढ़ जाओ
So I discussed this caution.
वो आजकल वो यासर खैबर नहीं कनेक्ट करता क्यों नहीं करता उसको बात किए कि नहीं? हाँ
स्टार जो है रिवर्जन मैंने शुरू कर दिया मैंने कुछ रिकॉर्डिंग ताकि
रिकॉर्डिंग का फायदा क्या है अगर कोई सीनियर नहीं है
हमारी बॉडी को बैक
listen to me what are you using it for you have to have a senior sitting there and guiding them अगर नहीं है तो तुम लोग क्यों नहीं अटेंड करते हो ये यंग सोसाइटी और WFNS यंग डिस्कशन फोरम और पाकिस्तान सोसाइटी के I'm giving a talk tomorrow everyone should attend It's crazy कि जो है वो एक चीज पढ़ाई जा रहे हैं हम लोग पाकिस्तान सोसाइटी के 4 लोग कनेक्टेड होते हैं बाकी जो है ना 80 लोग दूसरे होते हैं क्या वॉलेट निकालो अजय मैडम 2000 सॉरी थी वही 2000 मैंने बात करना खत्म हो गया या दोनों को एब्सेंट लगा देते हैं या फिर 2050 2000 में से तुम्हें थोड़े पैसे मिल जाएंगे वरना वो तो 3000 कट जाएगा और देखा देखा एब्सेंट लगा निकालो अपना उसका हाथ उनका देगा यार फ्रॉड मैडम 2000 एटीएम कर्जा लो चलो इससे कर्जा ले लिया तुमने 2000 कर्जा ले लिया तुमने इससे इसको वापस कर देना सुबह निकाल ये लो ये जमा करो तुम्हारी पार्टी है तो और भी कोई लेट आना है थोड़ा लेट आएगा या तो एब्सेंट लगेगी या 2000 रुपए
So this is an axial MRI. Here we can see
कैसे काज करता हूँ यस अभी सुबह 6 बजे निकलना पैदल आता है क्या चलो
this is
ये
an
हमने ये जब तो सवाल पूछो अभी जो पढ़ा है सवाल पूछो इससे
what are the two classification systems used to divide the jugular foramen?
2000 और निकाल
तो सारी
आगे फ्यूचर के देख लो तुम जवाब नहीं देता जाएगा हम ये करते रहेंगे हम लोग जब तक तुम हमारे पास है असल में हम लोग का खजाना कम होता चाहिए तो यार अच्छा चलो तो तुम बता दो भाई तुम जो देर से आई हो क्या कर रहे हो व्हाट इज द पॉइंट चलो इसको इसमें दिखा दो
So इनको उधर ही दिखाती हूँ कि हमने अभी So we have two classification system. One is this one. So this is the venous compartment and the neural compartment. Medially we have the
क्या पहले इनको ये बताओ ये नहीं बताया क्या है
jugular foramen.
जादू है
So this is the jugular foramen, which we have divided into three parts, two vascular and one is the neural compartment. So medially we have the inferior petrosal sinus traversing, and in the middle compartment, which is the interjugular compartment, is the glossopharyngeal, vagus and accessory nerves, along with the meningeal branch of the ascending pharyngeal artery.
पागल हो गए आपको भी 2000 रुपए निकालो तुम बात तुम लोग है ना तो तुमने 20 किसने ऑन किया है 28 पे कौन था सबसे पहले 28 पे लगाते हैं कभी एसी अपने घर में 28 पे लगाए कम करो इसको 21 करो हाँ गर्मी से बुरा हाल है मान भाई जुगुलर फोरामेन की क्लासिफिकेशन बताएं बस अब देर से आए ना हम लोग सबसे 2-2 हजार रुपए ले रहे हैं जो देर से आए चलो क्लासिफिकेशन पढ़ लें क्योंकि मुझे भी साल में एक दफा याद करता हूँ
So we divide jugular foramen into three parts, two vascular, two venous, and one is the neural compartment. So medially we have inferior petrosal sinus. Then middle or the interjugular part has the neural structures, which contains the glossopharyngeal, vagus, and accessory nerves, along with this meningeal branch of the ascending pharyngeal artery. And then laterally we have the sigmoid part, where the sigmoid sinus traverses and it drains into the internal jugular vein. So I was discussing this radiological view. Here we can see the carotid canal, which is divided from the jugular foramen by this carotid ridge. And this is the jugular foramen, which is divided into two via this jugular spine. So this is the pars nervosa and this is pars vascularis. This is two-part classification, basically. Here the sigmoid sinus runs, which drains into the internal jugular vein in this jugular foramen, and anteriorly in the pars nervosa, glossopharyngeal nerve exits, and posteriorly the 10th and 11th cranial nerve exits. And in this diagram, this is the MRI axial view. Here, this is the inferior petrosal sinus, which is traversing and draining into the internal jugular vein. And this is cavernous sinus drain करता है petrosal sinus. And then the pars vascularis, where the sigmoid sinus drains into the internal jugular vein. This is again the axial view. Here we can see the carotid. This is the CT scan. So this is the carotid canal where the internal carotid artery enters the skull. This is the jugular foramen, which is divided into two. Anteriorly, green one is showing the pars nervosa, where inferior petrosal sinus and cranial nerve 9, that is glossopharyngeal, is traversing. This is the jugular spine. And then posteriorly, we have the pars vascularis, where internal jugular vein forms where the sigmoid sinus drains and into the internal jugular vein, and we have cranial nerve 10 and 11 both. And this is the mastoid canalicularis, which is showing in the coronal CT. So here basically we have the cranial nerve 10, which is giving off the Arnold nerve or the auricular branch of the vagus nerve on its way from the lateral aspect of the pars vascularis of jugular foramen, which is towards the tympanomastoid fissure at posterior aspect of the external auditory canal, which is not shown here.